Hello, I'm Dr. Maria Sulindro. I'm specializing in physical medicine and rehab, but practicing as integrative medicine in anti-aging field. By the way, since the topic today and the guest speaker is Dr. Sahar Swidan, and we both are very familiar of how pain can be pain in the neck. Okay, so hi, hi, Dr. Swidan. How are you?
Hi, Dr. Solandero. Good. Thanks
Okay,
for having me.
thank you again for coming to my live YouTube because we are doing what we call community awareness, and pain is the best topic for anyone because if everyone who are listening today do not have pain, I hope you don't have pain, but at least you know someone who have pain, and this could be at least your education today because Dr. Sahar Swiden will share with us many different kind of how to take care of pain. Now, even for medical doctor, pain as a medical continuing medical education is required. We have to have 6 hours a year to continue to be able to continue to practice in our field. So you can imagine 60% of the populations now reach of the age of 60 and above. So anyone 60 and above do not never experience pain is very blessed. Okay. So maybe Dr. Swiden, we can start with how many kinds of major type of pain we have. Go ahead, Dr. Swiden. The floor is yours.
Yes, thank you. Well, definitely, really pain bridges every single specialty, as we know in medicine. People can have pain in the head, pain in the heart, pain in the stomach, gut, um, ovaries, testes, orthopedics, PM&R, back pain, neck pain. So there's a lot of different types of pain. So we have your typical visceral pain, kind of the belly aches, and what we call interstitial cystitis, kind of like bladder pain and things like that. And then the typical, migraine or head pain, or orthopedic, as we all get older, pain, as I call it, where your knees are hurting more, your joints are hurting more. So there's a lot of really different types of pain. And then also what we also have neuropathic pain, so this is like sometimes can be as a side effect of diabetes, so diabetic neuropathy. So that's that kind of the sharp shooting, burning type of pain that people complain about in the extremities, feet and hands and things like that. And then we have other kind of, more rare pain syndrome, like regional complex regional pain syndromes, or CRPS, and some of the other types of pain syndrome that sometimes can be very difficult. But definitely by far, we know the number one cause of disability worldwide is actually back pain. The number two cause of disability worldwide is migraine and headache. So by far, definitely, those would be the two most common types of pain that I think we encounter in our daily practice. And then, the arthritic type pain, right? The knees, the joints, the arms, and or shoulder bursitis, epicondylitis, and those kind of itis, as I call them, kinds of pain. So those are the most common.
Okay. Well, you can hear what Dr. Swiden has talked and taught us about how many kind of pains out there. But Dr. Swiden is a doctor of pharmacy and a CEO of Pharmacy Solution in Ann Arbor, Michigan. Actually, she completed her pharmaceutical doctorate degree and research fellowship in biopharmaceutical and gastroenterology at the University of Michigan. She is an associate professor and clinical research at the George Washington University School of Medicine and Health Science. Now, besides that, she was a director also before at the of a director of pharmacy at Chelsea Community Hospital and clinical pharmacist for inpatient head and chronic pain service. So she's overqualified to just talk about pain management today. She's also board certified in anti-aging and regenerative medicine and international renowned speaker in the area of pain management and headache including hormone replacement therapy. Many of you had probably heard 2 weeks ago, she talked about hormone replacement therapy or personalization of bioidentical hormone, or, what she call it, personalized hormone replacement therapy. She has authored several books, chapters, articles, and most recently, she has contributed authoring Metabolic Therapy in Orthopedics second edition. Now, that was last year. But recently, 6 months ago, she has authored her own book, and she wrote many chapters in the book titled The Advanced Therapeutic in Pain Medicine, and has many chapters of pain management that she's going to share with us today. Now, after some people can feel their pain when they eat the wrong thing as well. In the book, there's so many things going on, and I hope we can share with you some of what she believes. Okay, in what does diet have anything to do with the pain, Dr. Swidan?
Yeah, so that's a very common question. So sometimes when we kind of interview patients, pain patients, to see, because really, if you're eating the wrong types of food that are causing inflammation, in ITs, now in medicine, we have one specialty called inflammatology, right? So a lot of disease and chronic disease is really due to inflammation. So now diet, so for example, many people are familiar with gluten or wheat sensitivities or intolerances, or actually, if they have the disease, celiac disease. So when you're eating the wrong types of food that your body kind of perceives as foreign or bad for you, as we call it, your body can kind of elicit an inflammatory response to it. And really that excessive inflammation that we get from diet can really contribute to a lot of pain, syndromes, and could be one of the causes of either causing the pain or definitely increasing the intensity of the pain. And we see this very commonly sometimes when we pick up patients with wheat gluten intolerances, or like the nightshade family, like tomatoes and eggplant, or some people are allergic to beef and chicken, and so it depends. People can be allergic or intolerant to a variety of different foods. So it's very important to really look at your diet, and pain patients definitely should try to really eat an anti-inflammatory diet. So probably the more of a paleo, right? Not a lot of processed foods, really whole foods, clean foods, organic foods, anti-inflammatory diet, Mediterranean diet, to see is that really one of the contributing factors to their pain. The other thing is physicians like Dr. Salandera that do kind of functional and integrative medicine, there are some advanced testing that we could do to really see if you have food intolerances that we can pick up on and eliminate these foods from your diet, called an elimination diet, to see if that can improve your pain. So I definitely urge every pain patient to really look. So migraine patients, for example, they a lot of times they know, chocolate, caffeine, certain things definitely trigger their migraine. And it's really the same logic for other types of pain besides migraine. And so sometimes when we eliminate certain foods from their diet, cheeses, tyramine, foods high in tyramine, their migraines can dramatically improve. And it's the same thing for your knee pain or joint pain or gut pain, whatever it is, so definitely diet is one of the major potential contributors to inflammation and pain that we need to look at with you, assess, and try maybe elimination diets or anti-inflammatory diets to see if we can reduce the intensity and or severity of pain.
I agree totally, because of the T-junction problems in our gut. The food the inflammatory food can actually leaks also and cause the pain to be more intense in some patients immediately, and they feel it right away after whatever they eat. And gluten is definitely costing
and I think to that point, Maria, I think it's very important, because sometimes we ask patients, very commonly we'll ask them and go, is there any foods that you think can pinpoint to cause, pain or whatever? Migraines, they know a lot more quickly, because usually they'll eat something and a migraine comes on. Now, these like wheat gluten intolerances, dairy intolerances. So in this country, the more common allergy type or intolerances tend to be wheat gluten, dairy, soy, and corn, right? So, but this type of intolerance, as we call it, obviously, if somebody's truly allergic to something like a peanut allergy, people will know right away, right? Because, they may have difficulty breathing, wheezing, whatever, hives. So people know those types of allergies. These other types of intolerances, as we call them, or inflammatory causing foods, because they may eat something and not feel anything. And sometimes it's 24, 48, 72 hours later that, like, oh, my body's like really more achy. My joints are more achy. What's going on? And that's why it's really important for people to tune in, not necessarily just that time when they're eating something, but 1 day, 2 day, 3 days after, to see if they can correlate it with an increase in pain, inflammation, and intensity and severity.
You're very right. And most of my in my population or patients, we do have a test. So we do the IgE test. Obviously, that's the one like the peanuts allergies. This the immediate
Close
allergy.
your throat types of allergies, I call them. Yeah.
So the other one is the IgG, which is you can also experience it late reaction, like 2 to 3 days later. And for people who are listening, and those are called immunology testing. Okay, so that's what Dr. Sahar wants you to be aware, that these allergies of the immunoglobulin G can come 2 to 3 days or even a week later. Okay, thank you so much for that comment, and it's excellent. We often heard, though, that sleep has something to do with pain as well, Dr. Swidan. Can you comment on this one, please?
Yeah, so sleep is good for a lot of different things, right? We know this is a very sleep deprived society. Everybody's burning the candles at 50 ends and things like that. So sleep is very important, because that's really when your body kind of rest, regenerate, cellular detox, as we call it. Actually, this is a very recent discovery, but we have what's called the glymphatic system, which is basically the drainage system from your brain. So this is where you're kind of your brain, there's an oil change, if you will, at night, where it kind of takes all these toxins and inflammatory gunk and things like that and drains it into the lymphatic system to get rid of it. So this is really where a lot of regeneration and renewal occurs, is during sleep. But we know definitely and also a lot of clocks in the body, what we call the circadian rhythm clocks, what kind of keeps the motor ticking at certain times, also is very important for sleep. So we know a lot of regeneration, renewal, detox, and cleaning occurs during sleep. So it's very important for people to get, ideally 7 to 8 hours of sleep. Some people may need more, some people may need less. I was born with that. I'm assuming I don't have the clock gene, because I was always somebody that did not require a lot of sleep to kind of, function and stuff. But the average person really needs at least 7 to 8 good hours of restful sleep. So again, this is the problem. You want to sleep in a cooler environment without all the blue light. Everybody takes their phones and iPads and everything in there, and you want it nice, dark, cool, because also melatonin production occurs most commonly at night between 2 and 4 a.m. And melatonin is an antioxidant immune modulator that can also help with pain management. So it's very important, really. And we know when people don't have a good night's sleep, right? Besides that, they're moody and crabbier, as I call it. But really, it's very important for pain management, melatonin production, cellular cleansing, and detox, because the less gunk you have in your body, in the brain, the more we can clean up the gunk, that will also help all cells function better, more optimally, and less pain.
There you go. Yes, definitely. Now, since you mentioned about immune system, what about this so this immune system help modulate pain? Can we emphasize more on that?
Yeah, so definitely, like I said, now we have one medical specialty. It's called inflammatology, right? So we really believe inflammation is at the crux of a lot of things, whether it's neurodegenerative disease, whether it's heart disease, high blood pressure, diabetes. So in definitely pain. We know, people with pain tend to have higher inflammatory inflammatory markers. So for example, many studies have been done in patients with fibromyalgia, showing that they have elevation in these inflammatory markers. And certain treatments that we will talk about in a minute actually has been shown to lower these inflammatory markers. Like rheumatoid arthritis patient, we measure these like antigens or rheumatoid factor levels, anti-nuclear antibodies. So there's a lot of these either antibodies that kind of perceive your body parts or tissue as foreign, and it starts attacking and causing also damage and inflammation. Or we have inflammation that's coming from the diet, toxins in the environment, all this, organocide, pesticides and all those things that just basically cause higher levels of inflammation in the body. So some inflammation is okay. Actually, we need some inflammation for regeneration and repair. It's when inflammation is out of control that it can lead to more of these chronic illnesses and in symptoms that we feel. And obviously pain is one of the consequences of uncontrolled inflammation.
Okay. So now that you talk about inflammation, so is this what you call neuroinflammation? What is it?
So neuro, obviously neuro meaning brain, if you will, or on top part of the head. So there's really have been a lot of research now, looking at these kind of specialized cells called glial cells or glial cell excitation, that we're learning more and more about even, Alzheimer's disease, Parkinson's disease, migraine. Part of it is this neuroinflammation or brain on fire. So we know there's definitely certain peptides like CGRP, and one of the newer medication classes, which we talk about in the book for migraine management, is these CGRP antagonists. So they basically go and try to sequester one of these inflammatory peptides that are released, during a migraine that can kind of propagate the pain syndrome. We know, like, with amyloid plaques that you hear a lot about in Alzheimer's disease, tau proteins, which are kind of inflammatory markers and neuroinflammatory markers that a lot of research is going on to see how we can control this inflammation. Part of even now, really like refractory depression. So one of the treatments for refractory depression is ketamine. So ketamine is an opioid antagonist. And then you go, well, why in the heck are we using an opioid to control, to help with refractory depression? But actually ketamine, works on one of these inflammatory receptors called NMDA, not to get too technical, but again, just the main thing is there is a lot of movement in medicine now with neuro or brain inflammation stuff where we've seen it contribute to, refractory depression, Alzheimer's, Parkinson's, migraines, and other, syndromes that we really work hard now to control the gut-brain connection, because they talk a lot, right, through the vagus nerve. To really, that's why diet is so important for a lot of the neuroinflammatory, or what I call your brain on fire problems, that can kind of help to control the fire better per se. So definitely a lot of really interesting research. As you can tell, I love the brain. I've been in brain management, as I call it, for the past 25 years. And so there's a lot of really, research and development into this neuroinflammatory cascade and how we can control the fire that hopefully will lead to better control of the diseases that we're familiar with, like Parkinson's, Alzheimer's, migraines, depression, anxiety, neuropsychiatric illnesses, schizophrenia, and other things.
Okay. So you're talking about the CGRP inhibitors. Is that the one, the calcitonin gene?
Yes, the calcitonin gene-related peptide, inhibitors, which is really exciting because we did some of this research on these peptides for about, 22 years ago now. And finally, we have, some medications that can kind of really target that peptide specifically that can help with pain control and potentially many other things that are undergoing research right now, also for other indications.
Okay, that's something to do with migraine, right?
Yes, absolutely. So those specifically are for migraine. They're called the CGRP antagonists. So there's two kind of subclasses. One is these monoclonal antibodies that can kind of go and chew up these inflammatory, peptides per se, or oral ones that can kind of block where these inflammatory peptides work. So they work a bit differently, but they kind of target this inflammatory peptide that we know is one of the contributing factors to migraines.
Okay, so everyone, so just in case if you still wondering, those are, we tend to use the abbreviation because it's commonly used. So, but if it's, I think it's very clear now. And on the neuroinflammation. Now, Dr. Swidan, instead of drugs, some can actually immediately in my population of patients, they would like to know if there is a supplements that can manage this pain or mitigate the pain, and such as low dose naltrexone. Can you, even though it's drug, but low dose, can you emphasize on this one?
Yeah, so some supplements, absolutely. So even with anything, you always want to implement lifestyle, vitamin supplement, diet, foods. Food is thy medicine, right? So absolutely, you always want to start with that before we go to medications, if at all possible, right? So we always want people to sleep better, clean up their diet, eat less processed stuff, eat whole foods, paleo, anti-inflammatory diets, and then definitely, supplement with some things. We know some things like, curcumin, has been definitely, so it's one of the greatest anti-inflammatory and probably well-studied supplement. There's over 2,000 clinical trials on, curcumin in turmeric extract, right? Or curcumin. So, great supplement for pain, inflammation. I love that one. So that's a lot of time I go to. Boswellia, we use a lot in migraines initially to try to help. So boswellia, the main important thing with supplements is they're not all created equal. So it's very important to get pharmaceutical grade supplements that have been validated by third parties that to meet the label claim, because unfortunately, there's a lot of supplements. If you go to consumerlabs.org, for example, you really can kind of see this is an independent company. It's not paid by anybody that really review some of these supplements on the market, and they tell you which one is a better quality supplement. But definitely curcumin for pain, I love. Boswellia is great. Collagen or UC2, if you have any kind of itis, older knees, elbow pain, shoulder pain, you see like collagen, eggshell membrane can be very helpful for those kind of things. Bromelain, which is an extract from pineapple, what we call digestive enzymes. So digestive enzymes, we can use them with food to help digest the food better. But if you take them on an empty stomach, they're actually very anti-inflammatory. So we use those in two different ways. Lots of great data, out of Germany, even on specific types of enzymes. Like, for example, one of the products is Wobenzyme. They have over 30 clinical trials on those digestive enzymes. Probiotics, which is kind of the good bacteria or bugs, in your stomach. Those can be very helpful also to modulate the immune system. Remember, 80% of the immune system lines the GI tract, and that's why it's so important. That's why we always say, when in doubt, start with the gut first, as we call it in medicine, or because if you modulate the immune and inflammatory response from your GI tract, so probiotics can be immunomodulatory, also can help with pain and inflammation. And there's many, many more, but those are probably my go-to initially to start with, and to really add to a patient after they're sleeping better, anti-inflammatory diets, and to see if we can give them some of these supplements to kind of help, movement. A lot of times really, achy joints need to move. So sometimes, fibromyalgia patients, they're so sore, like, I don't want to move, it hurts. And absolutely it does. But we even just put them in what we call warm water pools. We just say, don't even move. But even just the actions of the warm water can really help the joints, lubricate them, and also kick the lactic acid out of their cells so they're not so achy. So even just simple sitting or taking baths at night with Epsom salt, which has magnesium, which is a muscle relaxant. And also, I love magnesium for pain. As you know, it's really one of the best things that we have for pain.
Yeah.
Help with that.
Excellent, excellent. So, one moment. How come I just lost this view here? Let me see how
Yeah,
to.
so it like but like with low dose naltrexone, and I know you kind of mentioned it. So low dose naltrexone is a medication, so it's not a supplement, but it's really unique, and there's a lot of clinical trials now on low dose naltrexone. We have over 250 clinical trials, really looking at the use of low dose naltrexone in a variety of pain, syndrome, autoimmune conditions. So I definitely urge you to research low dose naltrexone or talk to your healthcare provider to see if that treatment might be a potential option for you to kind of help with pain in about a variety of autoimmune conditions. What really low dose naltrexone is, it kind of brings the immune system, I call it, in balance. Usually when you have pain and autoimmune disease, that system is shifted. And so this just kind of brings the seesaw back in balance. And so low dose naltrexone has been very helpful additional tool that we have really in our effort to control pain in autoimmune illnesses. So it's a great one to look at, research, and talk to your provider to see if that's a good option for you.
Yes, yes, and it's a prescription only, and it's filled by the pharmacy.
Yeah.
Yeah. Now, thank you so much for that. And what about this palmitoylethanolamide, which is the PEA, a
Yeah.
natural painkiller? Can you talk about that a little bit?
Yeah, so with palmitoyl ethanolamide, so PEA or P is much easier to pronounce. So it's very interesting. So this is another supplement, if you will, that's out of Europe. So there's over 30 clinical trials with PEA in a variety of pain syndromes. So this is another one that really works on the cannabinoid system, kind of like CBD that people are familiar with, and the many other phytocannabinoids now that are on the market and in development. So PEE is kind of like a cannabinoid and anti-inflammatory. So it's like a mast cell stabilizer, which is one other part of the immune system that sometimes is revved up in pain with cannabis, that really helps to modulate the pain at that kind of the higher level, or the conductor of the orchestra, as I call it. So PEA is a supplement available in the United States in certain products, but again, make sure it's a quality supplement, pharmaceutical grade, been vetted by third party. But that's another one that can be very helpful in the treatment of a variety of pain disorders that we have too. And so that's also has been a nice addition to our treatment armamentarium in pain management.
Now that you mentioned cannabis, with the PA, you mean to give it together with cannabis? Can you also say something about the role of cannabis in pain modulation?
So, well, that's an 8-hour topic that I lecture on, literally. So we'll try to answer it in 1 minute or less, right? So, I mean, medical cannabis, obviously, it's a huge topic, lots of questions and things like that. So, I I really, I'm not a huge fan of what I call single cannabinoids, so you see a lot of people like, oh, I only use CBD, or I only use CBG, or I only use THC, right? These are the subcomponents of the cannabis plant. So the cannabis plant has over 560 different phytocannabinoids in them. So the two most famous ones, obviously, that everybody knows almost, is CBD and THC, right? But I like to look for a mixed phytocannabinoid, because we know when we put all these phytocannabinoids together, we have what's called the entourage effect, where a little bit of each of them work really nicely together and synergistically. And so we can use a lot lower doses with those. So I like to find, most patients don't need the THC. Sometimes that can be helpful in some neuropsychiatric illnesses. So I like to find a mixed phytocannabinoid that we use for pain, that's low or no THC, for general pain control. And, oral, if it's more widespread pain, you want something orally because they can work everywhere. If it's something more localized, then sometimes topical, topical mixed phytocannabinoid can be very helpful in a salve cream or whatever, some of the different formulations out there. But, please note, everybody thinks, quote unquote, it's natural. And I tease people and I go, well, so is cyanide. It's natural too, but obviously it can kill you. But, please always check with your healthcare provider or pharmacist before starting medical cannabis or CBD or THC or a phytocannabinoid, because they do have interactions with certain medications, and supplements can have potential interactions with medication. So I always urge everyone before starting any treatment to always check with your healthcare provider or pharmacist to make sure that they're not interacting, including medical cannabis or CBD. It can definitely, absolutely have certain interactions with some medications.
Okay, thank you so much. Very clear. And when we have pain, usually before we decided to take this, to take that, we are hoping that, tender loving care like physical therapy, acupuncture, and osteopathic manipulation treatment, they are very like personal, like they're close to us. So what your thought about this to help the pain?
Yeah, no, absolutely. So, again, you always want to try all these modalities, and all of us, I think, in healthcare try all these modalities, whether it's, like I said, better lifestyle, sleeping better, eating better, less inflammatory, taking certain, supplements that are targeted that may help with the pain and stuff, potential phytocannabinoids. But absolutely, we know there's lots of trials that looked at physical therapy, acupuncture, OMT, craniosacral therapy that can absolutely be very helpful in either, acute pain and injuries or chronic pain and injuries that can be very helpful. So these are all absolutely part of and really pain is multifactorial. So a lot of times we do have to kind of hit it from different perspectives, in ITs, like in school, a lot of times we kind of learned, well, non-steroidals, kind of like the ibuprofen drug class, opioids, which everybody knows about, and ice and heat. And that's honestly why I wrote this book, because I really wanted to give clinicians and patients other options to think about and consider in the treatment of pain, as we all hopefully will continue to more appropriately use opioids. Again, now everybody's like, oh, we have an opioid crisis. We have an opioid crisis. Well, we've had an opioid crisis for 25 years. I don't know why it's just all of a sudden more important, but, but definitely, is there a role for opioids? Yes, but it's very limited role, really, in many of the studies that have been done, and especially in not a huge role, really, in chronic pain management. So you absolutely want to look at all these options, that we discussed today. We outline more in the book, because you really want to implement a lot of these before going down the path to other things. So I love PT, acupuncture, OMT, sometimes even certain selected blocks, PM&R docs like you, obviously, anesthesiologists, interventional pain specialists sometimes can do certain blocks that can also be very helpful in kind of cut the pain pathways, while we also work on PT, OT, diet, sleep, supplements, things like that, to kind of help, short circuit the pain wire, as I call it, obviously, to give people better pain control.
Well, thanks.
Yeah.
Thanks, Dr. Swidan. That's a very good, across the board of all the pain management available. And recently, for the past 2 years, I come across to a certain red light that is used in a multi-lumen, tetralumen, hemalumen, all these, like a low laser type of intervention pain management, which also helps, which is
Absolutely,
very, yeah. And sorry to go past 30 minutes, but can you please just give any take-home message for the audience before I close?
Yeah, I think so. Kind of the good wrap up is really, pain obviously literally bridges every medical specialty, and you can have any kind of pain. And that's why it's really important for every clinician to kind of learn a variety of these different tools that we talked about. and you know, to really help with pain management. But remember, you know, pain is multifactorial. So that's why a lot of times, you know, they go, well, this pill is not helping or that pill is not helping, because really it is a concerted effort and multifactorial. You have to look at your diet and what's causing potential inflammation, which is always going to drive that fire and pain. You know, sleep, physical movement, less stress. We know when people, their stress, their DHEA levels sometimes can be altered, which is a hormone of anti-inflammatory hormone that the body has. Cortisol is the body's natural anti-inflammatory. So we talked about hormones a couple of weeks ago, but it's very important component of pain management too, that we look at and assess, you know, and try to control kind of stress, because we want these inflammatory hormones in check also. You know, and definitely look at targeted supplements that you can add to your diet, or anti-inflammatory foods. You know, add more turmeric in your cooking. Ginger is great for pain management. You know, add a lot of these really spices that have anti-inflammatory component. Sleep good, dark, cold room, and definitely look at these other options to kind of help with pain management, like low dose naltrexone, PEA, you know, maybe targeted phytocannabinoids that can kind of help. And absolutely work with other clinicians that do, you know, PT, acupuncture, OMT, craniosacral, and some of the laser lights, you know, absolutely, you know, photobiomodulation is really kind of an upcoming huge field that looks into different like light spectrums and their effect on a variety of different disease state management. And definitely one of them is pain with these.
Okay, well, thank you so much for all the take-home message you gave. I think it's very, very helpful. And for everyone who is listening, I say keep your thumbs up for this video for on Dr. Sahar Swidan. Okay, and then she's the CEO of the a pharmacy called Pharmacy Solution in Ann Arbor, Michigan. Thank you, Dr. Sahar Swidan. I call you all the time, so and you call me Maria, so when you call me my last name,
no, I know. Yeah, thank you, Maria. It's always a pleasure to see you and be with you. I hope this was helpful to your audience.
yes, so this is very helpful for the community awareness. And I'm Dr. Maria Sulindra, integrative anti-aging medicine in Pasadena, California. Next time we'll see you again, Dr. Swidan.
Thank you. Take care. Bye.
Bye.